In this video, I will try to present how we introduce and how we use the online calculators to calculate the sample size. There are so many calculators. Some of them are open line calculators, and I will show you here. One of them is the Clinic Calc. Clinic Calc. We'll open the Clinic Calc and calculator, and we find that the Clinic Calc uses a study group design, two independent study groups or one study group versus population. This one will study the mean versus population mean. And if we study the two groups, probably we are going to use the proportions in the form of categorical data for comparison. Or also we can use, with the two independent study groups, we can use continuous mean, like estimating a parameter like hospitalization period. And if you go on, then we have to insert the data, the statistical parameters, anticipated means. For example, if we are using two samples with continuous means, here we are going to anticipated means in group 1 and group 2. The anticipated means, the anticipated mean plus minus the standard deviation. And we have to decide the enrollment in the ratio of the two groups, either 1:1 or 1:2. And it will calculate for us, the calculator will calculate with a statistical significance of equal or less than 0.05 and power of statistics of 80%. And then we are going to calculate the result. Let us now introduce some data for a research title, for example, saying evaluation of surgical registrars. If you are going to study a pass mark in a training program, and how many of our registrars will pass with the expected pass mark. Evaluation of surgical registrar program in basic life support, or in advanced trauma life support, or in CPR, cardiopulmonary resuscitation, or even in just securing a patent airway. And we can use it as a prospective cohort study or cross-sectional study. In this study, the population mean, when we see registrars and the training, the usual mean for these is about 65%. Plus minus, since it is a mean, plus minus standard deviation 5, it could be 70%, it could be 60%. And here, in this case, we are going to use just one study sample, one study group of registrars to compare their mean with the population mean. And the population mean from the literature, or from an expert person, or from any previous study, pilot study or so, we know it could be something like, let us say, 65 plus minus standard deviation 5. That it could be 60, it could be 70. And for the study group, we expect it to be 70. This is the mean of the expected group of registrars for training. Now we would like to know how many registrars should we incorporate in such a training program. Then we have to, we take the power of statistics at 80. This line can adjust it to 90 or any figure we like, but usually it is taken as 80 and the statistical figure 0.05. And then we have to calculate and see what figures. Okay, the sample size will be 8 registrars in the group. 8 registrars. We have the chance also probably to add, say, 20%. If we added 20%, it will be 1 point something. If we just make the whole thing 10 registrars for the program of training. In one of these training programs, we have already said 10 registrars will give us a value of 70% estimated group mean for their pass. Now we can see another, or in this same calculator, we can calculate 2 independent study groups. That was one is group with the population mean. And these 2 groups with a dichotomous outcomes, that is proportions. And let us take it as an example of say prophylactic antibiotics and risk of surgical site infection in appendicectomy, and whether it is laparoscopic or open appendicectomy. It can be case control in 2 groups. And then we can just enter our data. Here we anticipated incidence. The incidence in group 1 of infection rate, surgical site infection rate, we expected, say, it would be 8%. And in group 2, let it be, for example, 21% in open cholecystectomy or open appendicectomy. Let us take it as 21%. And now we have to cut. These are incidences in percentage. And usually we get estimations of incidence or expected incidence from the literature or from an expert person to tell us what is the usual incidence of wound infection or in cholecystectomies or in laparotomies or whatever it is. And here we are taking the ratio between groups 1:1 between the 2 groups. And the significance of statistics 0.05 and the power of statistic 80%. Then we calculate the sample size. The sample size will come to be 114 for group 1 and 114 for group 2, being laparoscopic and open surgery. If we go back and make it the group ratio 2:1, so we will make this 2. And we calculate again, and the ratio between groups is 2:1, and calculate, and the ratio will be 89 for group 1, probably laparoscopy, and 178 for group 2. And the total is 267. Now we can explore another. You can explore another calculator, like this calculator, which is MedCalc. In the MedCalc, if we go along the literature of the MedCalc to the bottom, we will find that there are some statistical tests and sample size calculation and post hoc power analysis. We want sample size calculation. We press on sample size calculation, and here what do we need? Is it a single proportion or comparison of means or comparison of proportions? Let us see if we compare proportions, comparison of proportions. And let us take an example for comparison of proportions, that evaluation of CRP in acute versus severely acute appendicitis. C-reactive protein evaluation or estimation of C-reactive protein in acute and in acute severe appendicitis, severely acute, severely inflamed appendix, a cohort study or a cross-sectional study. Then we have to insert the expected data. Here, this calculator, the MedCalc, will use type 1 error, which is equivalent to the significance ratio 0.05. And when we speak about error, it means that the probability of detecting a difference which is not there exactly. But anyhow, the figure is 0.05. We don't want to go into the mess of alpha 1 and alpha 2 errors, type 1 and type 2 errors. And the second one is type 2 error, which is equivalent to the statistical power, which is 80%. 0.2 is equivalent to 80% statistical power. And then the first proportion for our CRP cases. In the CRP cases, we put in the, let us suggest the first proportion, the difference between proportions. The first proportion is 10. No, we are using the wrong calculation. Here we should calculate for estimates. Anyhow, here, yeah, you can go back. Sample size calculation, and we use estimation of means, comparison of means when we compare the means, because we are estimating a parameter. And here the difference expected will be 10 milligram per liter. 10 milligram per liter. This is the difference expected between the two. And the standard deviation for group 1, for example, acute appendicitis, will be equal acute severe pancreatitis, let us say 15 point, probably let us say 9. And for simple appendicitis, this one, the standard deviation for group 2, this is point. Here it is 7.9. this is a standard deviation, 7.9. And the ratio between groups is 1 to 1. And then we can ask to calculate, okay. And we see the sample size for us. For us, we need 26 cases in each group, a total of 52 cases to estimate the C-reactive protein in appendicitis, in acute appendicitis, and in severely inflamed appendix. The appendix could be just inflamed or could be severely inflamed, containing pus or gangrenous or ruptured appendix, like that. The difference in C-reactive protein and the estimations will be, we need about 26 in each group for a case control study, or for a cohort study, or then let us see in the same probability calculator, or let us try another calculator. And this could be OpenEpi. OpenEpi. Here we see in the menu it contains also statistics, and at the bottom sample size, in which they use it for proportions, for unmatched case control, and for cohort and randomized control trials, and mean differences. Now, if we have, for example, a study about negative pressure wound therapy versus standard moist wound dressing, randomized control trial, or cohort study, or case control, or cross-sectional study, then we can see this is the calculator here, just to make it a little bit bigger. There are line about 95% confidence and power 80%, and the ratio between groups 1, and then we have to estimate the percentage of the unexposed group. In our study, when we are speaking about negative pressure wound therapy, this is the exposed, and the non-exposed are the routine moist dressing. So here we have to insert, first we have to agree, do we need the group ratio 1 to 1, or we need the group ratio 2 to 1? One negative pressure dressing therapy, wound therapy, or two will be the routine moist dressing, or can be 1 to 1. And we have to insert also the percentage of unexposed, the routine dressing. What is it? We want this percentage, let us say 45%. Here we have to enter new data. The confidence interval, as usual, 95, and the statistical power 80, and the group ratio 1 to 1, and the proportion of unexposed, that is the normal routine dressing, let us say it will be equivalent to 45. And then will ask us if we know the odd ratio. Here he said, please insert one of the following. Not all the three, it is only one of the following. Either the odd ratio, we don't know. The percent of exposed, that is the negative pressure wound therapy. The expected percentage, we will expect the expected percentage to be around, let us say, 20. Let us say 20. And we accept all these. Then we go here and calculate and see the results. These are the results of calculation. At the confidence interval of 95% and a statistical power 80, and sample, the group to group is 1:1, and the percentage of the unexposed outcome, and that is the normal dressing, is 45%, and the exposed, which is the negative pressure wound therapy, is 20. Here, the calculator calculated for us the odds ratio and the risk and these things, but we are interested in the sample size. Here is the sample size of the exposed of the negative pressure wound therapy, 57, and since the group ratio is 1:1, the sample size for the normal dressing, the unexposed, is 71, and the total is 114. This is a Kelsey method, of Fleiss method. It is almost the same number. 57 became 56, and the total became 112 instead of 114. And with correction, the Fleiss with correction, it will be 63 in each group with a total of 126. Correction for the attrition, for those whom we couldn't follow up, whether they were displaced or they moved to another place, or anyhow they disappeared and we couldn't follow up. This is their correction. He added the correction here. Here, anyhow, the sample size can tell us. Let us try in this same calculator and see if we can use the group, the same group, but we use it in 2:1. And this is it. And here, enter new data. We said confidence 95% and the power 80%, and the group 2:1. So we insert here 2. 2 means 2:1. And we said this is 45, right? And the expected for the negative pressure percent of the exposed, it is here, let us say 20% as before. And we go back and calculate. Here is the calculation with the same parameters. The confidence interval 90%, 80% power, the groups with a ratio of 2:1, and the normal dressing unexposed in the 45, and we set the exposure for the negative pressure therapy, which is, we put it suggested as 45. Usually we set this, we get it either from the literature or from an expert. And the size for the exposed sample, that is the negative pressure wound therapy, is 45 patients. And for the routine moist wound dressing is 90 patients. These are examples of how to use the online calculators. The most important thing to me is to know on what basis do we calculate the sample size. On what basis? This is the most important question we should answer first, and then we find the sample size And after that, we see how to collect the samples. To this point, I will end the subject of the calculation of the sample size, and next videos will be about how to do the sampling and how to collect, what are the methods we use for collection of these samples.